Hello everyone. So today we will talk about hereditary hemorrhagic telangiectasia, which is also called as Osler-Weber-Rendu disease. So in this image, I've tried to explain it in a very simple way. So we can see that there is a boy, and you can see that there's going to be bleeding from his nose, and there's going to be coughing up blood. So you can see that there's going to be a lot of recurrent epistaxis episodes in the childhood, and there's going to be coughing of blood, which is hemoptysis. And remember, this is because of the nasal telangiectasias. Okay, this patient can also have a risk of hemorrhagic CVA. And then remember, in this condition, you have a lot of AV malformations everywhere. Okay, so basically connection between the artery and the vein, so AV malformations. Now let's talk about the lungs. This is very important because of the pulmonary AVM. You can see a characteristic finding that they'll tell you. They will tell you that there are going to be multifocal, well circumscribed, smooth nodules with no calcification. So can you see I've drawn like these smooth nodules, and they've written no calcium. So this is how they'll describe. So these are nothing else but these are AVM, and because of these AVM, you can also listen to an auscultatory finding, which is called as a faint continuous bruit on the right infrascapular region. So infrascapular region on the right side, you can listen to a faint bruit, okay, infrascapular, and that is also because of your AVMs, okay, and this hemoptysis is also because of the AVMs. And then when you talk about the GI AVMs, remember that it can produce iron deficiency anemia because of the GI AVMs, and also remember that it can affect the liver for producing portal hypertension. And why I have shown and this is iron box, like box made of iron, and that's why iron deficiency anemia. And why I have shown a normal urine is because these findings can be confused with another important condition, which is called as GPA, that is granulomatosis with polyangiitis. And in that condition, remember that they will have microscopic hematuria on urine analysis. Okay, so but in this case it won't be there. So that's one way you can confirm. Thank you.